Hi guys, I'm Mikhail from Prague ICU, and in this video I will demonstrate how to insert an intra-aortic balloon counterpulsation. In our simulation, we will use the Mackay Datascope CS300 machine with the 50cc balloon catheter. Start the console, then the machine begins to load. First of all, let's get oriented in the CS300 machine. Here is the helium tank. Then there is ECG input, pressure input, and ECG and pressure input from a monitor. Here is balloon pump catheter helium input and balloon fiber optic sensor input. Before the procedure, prime and hang a single transducer setup. Then connect the transducer cables between tubing and console. Attach the end of the cable here to the pressure input slot. Before preparing the sterile field, place the ECG leads to the patient. This is imperative to do before draping the patient. Connect ECG cable to the console and then attach the leads to the patient. Now you can see a single lead ECG waveform on the monitor. On a sterile trolley, prepare a sterile gauze, local disinfection chlorhexidine, sterile probe, cover and gel, needle and syringe with a local anesthetic, scalpel, scissors and clamp. On a second trolley, prepare a large fenestrated sterile drape and balloon pump components that consists of two parts. The balloon catheter tray contains the balloon pump components. Here is the catheter extension tubing, cable to fiber optic signal processor, and syringe with a one-way valve that we use to fully collapse the balloon before insertion. Finally, here we can see the intra-aortic balloon itself. The insertion tray contains tools for percutaneous insertion, guide wire, 18-gauge insertion needle, tissue dilator, and sheath. Then helium connecting tubing and another pressure connecting tubing with a 3-way stopcock. First, apply the aseptic skin prep widely around the insertion site. Start from the center and move out. Never come back to the center. Then drape the intended area. Anesthetize the skin and subcutaneous tissues with a local anesthetic. Before starting the procedure, have everything prepared by side: guide wire, needle, dilator, and sheath. Access the femoral artery at 45 degrees with a needle under ultrasound. Pass the guide wire through the needle and advance until the tip is in a thoracic aorta. Wire should pass very easily. Make a small superficial incision at the entry point of the wire that will facilitate the passage of the dilator. Insert introducer dilator into a sheath hub and then pass the sheet over the wire. Finally, remove the introducing dilator while leaving the wire within the sheath. Before insertion, fully collapse the balloon, applying vacuum with the 60 ml syringe. You can see that after the first attempt, there is still some remaining air left, so we'll proceed with aspiration for the second time. Remove the syringe while keeping the one-way valve in place. Manually flush an inner lumen with 3 to 5 ml of flush solution. Remove balloon catheter from a T-handle by pulling straight out to avoid damaging it, and insert it through the sheath over the guide wire until correct placement is achieved. Balloon should be positioned so that the tip is about 1 to 2 centimeters distal to the origin of the subclavian artery visualized on TOE. Or chest X-ray or fluoroscopy confirms the radial-opaque tip lies approximately 2 centimeters above the carina. Advance shield sheath into hub of sheath. It will allow you repositioning of the balloon catheter under aseptic conditions. Secure the catheter to the patient's leg with sutures. Now remove the wire and attach a 3-way stopcock. Connect the tubing to the transducer and flush the lumina of the pressure tubing and balloon catheter. Then you can monitor intra-aortic pressure. Pass the fiber optic line to the circulator, who will gently slide it to the console. Finally, remove the one-way valve from the balloon catheter and attach the gas line from the sterile field. Pass it to the circulator and connect the helium tubing to the console. Now you can commence the therapy. Here is the signal from aorta with a pressure waveform. Above is the ECG waveform. We need to double check that an auto mode is set up. Trigger source is ECG, frequency is 1:1, and there is a maximal augmentation. Then we can press the start button, after which the system automatically purges and fills the balloon catheter. It automatically performs an in vivo calibration. It automatically selects the most appropriate lead and trigger, and it automatically sets inflation and deflation timing. Also note that with a Datascope fiber optic balloon pump, there is no need to zero. Calibration occurs automatically after pressing start. This is the balloon pump waveform. We can also appreciate the 1:1 diastolic augmentation on the arterial waveform. And this is all for now. Thank you for watching Prague ICU and stay tuned for next educational videos.